Welcome to the special edition of Neurology News Network. I'm Marco Meglio. Please excuse our appearance this week as a majority of the U.S. workforce, including the Neurology Live team, moves to working remote as we come together to help reduce the spread of the novel coronavirus. First up, Amylyx Pharmaceuticals has announced that it is prepared to submit a new drug application to the FDA for its investigational agent AMX0035 for the treatment of ALS. The decision was made based on a recent discussion between the FDA and Amylyx, according to the company. Joshua Cohen, co-CEO, chairman and co-founder of Amylyx, said in a statement that the company was thrilled to move towards the U.S. submission and that they look forward to continuing to work with the FDA. The ALS Association lauded the news of Amylyx's decision to move forward with the submission of the NDA, marking its ongoing and long-standing support of the combination therapy. In June of 2016, the association provided $750,000 in grant funding to Amylyx for a pilot trial of the therapy, following that up with a $1.46 million grant to the Northeastern ALS Consortium to aid in funding the Phase 2 clinical trial. Next up, the FDA has cleared an expanded indication for electrocore's gamma-core non-invasive vagus nerve stimulation, or NVNS, to treat patients with paroxysmal hemicrania, or PH, and hemicrania continua, or HC, in adults, making it the first treatment, drug, or device to be approved for these patient populations. Data from multiple clinical audits and case series/case reports that included patients with PH or HC were the basis for the label expansion. Among a cohort of 14 patients with PH and 19 patients with HC, 79% of those experienced clinically meaningful benefits from the device for each indication. This included decreases in the severity of persistent pain and or reductions in the frequency, severity, and or duration of attacks. Notably, many patients reported at least one clinical benefit and no serious or unexpected adverse events occurred as well. Lastly, findings from a nationwide retrospective population-based cohort study of Danish citizens aged less than 50 years old revealed that epilepsy is a major risk factor for sudden unexplained death, only second to cancer in adults and pneumonia in children. In addition, a lower sudden unexplained death in epilepsy, or SUDEP risk, was observed in children compared to adults. The final data set included over 3.8 million individuals, with 30,000 plus of which had prevalent epilepsy, who were followed around for over 10 million person years. Despite only representing 0.8% of the population, 700 of the 7,825 recorded deaths were by persons with epilepsy, corresponding to 8.9% of deaths. In comparison, only 0.2% of persons without epilepsy died during the study period. For more direct access to expert insight, head to neurologylive.com. This has been Neurology News Network. Thanks for watching.